Hi, my name is Rachel Davis. And here is my student ID. All right, I'm going to record around the room.
Messy house.
Just getting ready for Christmas. All right. And we are.
Can you see me if I'm
Yeah.
right here? You see me down here?
Yep.
Okay.
Hi, my name is Rachel Davis. We're going to be doing an abdominal exam on you today.
Okay.
So for most of that, I'm going to need your shirt up.
Okay.
Basically
Should I do
all the
that
way
now?
up, yep, to, yep. And I'm going to bring your shorts down. Sorry, it's a little personal.
That's all right.
And at first I'm just going to inspect. I'm just checking to make sure it's symmetric. Checking for any scars, lesions. I don't notice, I feel like it is very symmetric. There's no protrusions. There's stretch marks throughout, which is normal.
You made those stretch marks, just so you know.
I also do not visualize any aortic pulsations or peristalsis. And I'm going to listen first before I press around. Okay. I'm going to listen with the diaphragm of my stethoscope. And you have normal active bowel sounds, just meaning that I can hear little clicks and gurgles, letting me know that there is movement in there.
Okay.
And then I'm going to listen over your liver and spleen for friction rubs. And your liver is actually right about here.
I didn't know they made noise.
They shouldn't. That would be a problem.
Okay.
And then your spleen is right around here. No friction rubs heard, so that's good. That's normal. And then I'm going to listen for bruits over your aorta, renal, iliac, and femoral arteries. We'll use the bell for that. Just flip that around. Your aorta artery is right about here. We're going to go to the side. The femoral arteries are down here, so I'm just going to go just right under.
Okay.
I will keep you concealed. All right, no bruits are heard, so that's a good normal. We don't want to hear anything.
Okay.
All right. And then I'm going to listen at the epigastric area and the umbilicus with bell. Again, we don't want to hear anything. That's like right here. And over your belly button.
I didn't think I'm listening.
No venous hums heard.
Let's just stay in there, baby.
And now I'm going to perform percussion, a technique called percussion. I'm going to basically place my finger on your skin. I did this when we did our respiratory exam, so,
Okay.
and I'm just going to tap throughout. I'm just listening. All right.
What are you checking for?
Sound. I want to hear that it's tympanic and not dull. Like dull would mean that there's extra fluid in there that doesn't belong there.
Okay.
And all I heard was tympanic or timpani.
Okay.
And then I am going to percuss the liver. So basically I'm measuring the vertical span of liver. So I need my, oh, here it is. So I'm gonna start up kind of high. Sorry.
You're fine.
And basically I'm just listening for the sound to change. So it changed right there. Sorry, making a little mark on you.
Okay.
And then I'm gonna start down here. Our liver is actually pretty large. And the sound changes right there. And we want that to be between 6 and 12 centimeters, and yours is right at 6. That's perfect. And then I'm going to percuss the spleen. So that's all the way down here, and I just want you to take a deep breath. Oh, you bless you.
I'm okay now.
Okay. All right, take a deep breath in. Let it out. All right. That timpani is heard, so that's what we want. All right, and now I'm going to press. Okay, so let me know if you feel any tenderness. I'm going to just lightly press. Any pain?
Not yet.
Okay. Now I'm going to be a little more deeper, okay? Any pain or tenderness?
No.
Okay. And then I did not feel any masses. Everything felt good and normal. I'm going to palpate the liver edge. It's kind of sometimes we can feel it, sometimes we can't. Basically, I'm going to kind of hook my fingers underneath your rib cage here, and I'm going to have you take a deep breath. Okay, and then let it out. And let's do that one more time. And let it out. Sorry, and I could feel it. The little edge of your liver is smooth. And then I'm going to also try and palpate the spleen. So this one I'm just going to reach over and kind of anchor you down here. Sorry, we're getting personal.
Okay.
And then I'm going to stick my hand here. I want you to take a deep breath in and let it out. I do not feel it, and honestly, you rarely would feel someone's spleen. That would usually mean it's enlarged, and that would be concerning.
Oh, okay.
Okay. And then I'm going to palpate your kidneys. So that's a hand on the back again.
Okay.
All right, and one right here. And just take a deep breath in, and then let it out. And I'm just pressing. I'm gonna come on the other side to check for your other kidney.
As much as I drink soda, it's probably not very good.
All right, take a deep breath in and let it out. Nope, I do not feel your kidneys, and that's normal.
Okay.
I shouldn't be able to feel them. Sometimes we can. And then I already kind of did this earlier, but I'm testing to see if you have any extra fluid in your stomach that shouldn't be there. It's called ascites. So again, that is a percussion where I'm tapping my finger.
Okay.
Come to the other side. I think it's difficult to do. And I'm just listening for a change in sound. If it became more dull when you lay there, the fluid will go to the sides.
Okay.
So if you had extra fluid, I would hear a change in sound, but I don't. All right, so negative for ascites. And then I'm going to test for appendicitis now. We have several different signs for that. So the first one is a Robsing sign, where I'm going to press, so our appendix is over here. I'm going to press firmly over there and let go really quickly. I just want you to let me know if you feel any tenderness over here.
Okay.
I know, sorry. I know. It's natural to just guard, but all right.
No?
No pain? All right.
No.
And then the next one I'm going to do is the psoas sign. So that's uncross your legs for me. I'm just going to push down, and I just want you to raise your leg against my resistance. Okay. Do you feel any pain or tenderness in your lower abdomen?
No.
Okay. And then the next one I'm going to do is the obturator sign. So I'm going to flex this leg. Okay. And I'm going to turn your leg out like this. Does that cause any pain,
No.
discomfort in this?
No, not
Okay.
in my stomach, no.
All right, so negative for appendicitis. And then I'm going to check your gallbladder, even though you don't have one.
I don't like what you, I don't want to
And I'm just going to have you, I'm just going
Would
to,
you know I didn't have one if you were checking it, you think?
I don't think so. All right, take a deep breath in. All right, and let it out. And does that cause you any pain or tenderness? Your gallbladder is kind of tucked right underneath your liver there.
Okay.
All right, so negative for cholecystitis. And then the last thing I'm going to do is I need you to sit up on the edge there with your legs that way.
Okay.
I'm just going to check your kidneys for any tenderness. We call it CVA tenderness, okay?
Raise this up.
Yeah, I'm going to have you turn this way just a little bit so that we can still see what I'm doing.
Okay.
I'm just going to... Sorry, I don't want to tickle you. I'm just trying to find the right spot. All right. Does that cause any pain?
No.
Okay. I'm just checking both sides of your kidneys here. Any pain?
No.
Okay. Well, that concludes our abdominal exam for today.
Okay. That was bad.